Hello, this is Nathan Radcliffe with Interventional Mindset, and I'd like to talk to you about intraoperative considerations for the placement of Dexycu and cataract and glaucoma surgery. I'd like to begin with just a little background. Because many of my patients have glaucoma and are on many eye drops, I began adopting Dexycu at the time of cataract surgery and often cataract surgery with MIGS very early on. It was great for me to see patients not needing a steroid after their cataract MIGS surgery because many of them were already on other glaucoma medications and they needed relief from taking so many drops. I had an excellent experience post-operatively with my patients, getting them off the steroid drop or never needing it in the first place, and getting their pressure down as well. And most importantly, I found my MIGS outcomes were excellent. I didn't identify any steroid responses, and to the contrary, I was able to taper glaucoma medications, and I saw the pressures come down quite nicely. Intraoperatively, there was a bit of a learning curve to using Dexycu, and it's an interesting thing because although Dexycu is a drug and it's a medication, in a way it's a surgical technique. You're placing a very small bubble of dexamethasone into the eye, and you want to get it just right. After all, this is part of a cataract surgery, and we're all meticulous about those outcomes. I had a great experience discussing different techniques with my colleagues, and I learned a lot. And eventually my technique evolved to the technique that I'll show you today. And this technique involves placing the Dexycu either in the capsular bag or on the intraocular lens in a peripheral location out of the visual axis, but towards the edge of the capsule. So here we are performing the cataract extraction. I'm going to make a slightly large rhexis. The whole point here is to just give some space where you can place the drug on the anterior optic where you won't have the capsular rhexis around. Similarly though, you can place Dexycu peripheral to the optic in the bag. But I make a little notch here, and this is where I'm going to place my Dexycu after I put the intraocular lens in. Place the IOL, and I will now complete the MIGS part of the surgery, which is 2 iStent injects. iStent inject is completely compatible with Dexycu, as are all trabecular MIGS. We have no problem with stents being clogged by Dexycu. We have no problem with IOP spikes. What we do have is great pressure control after with a patient who doesn't need to take a topical steroid, and that's a relief if they're also taking glaucoma medications. I always like to keep the anterior chamber well formed after MIGS to prevent any bleeding, and with Dexycu that all fits together. So after I place my stents, I'm going to begin sealing my wounds. I do use a little bit of myostat. I also use a little bit of intracameral moxifloxacin, and that way patients can avoid using an antibiotic as well. But here I am sealing my wounds. I want the chamber to be firm, so that when I go in with a Dexycu cannula, I'm not going to have to worry about losing the chamber or having aqueous escape through any of my wounds. Coming in now with the Dexycu, I'm going to be able to place it right where that notch is, under the peripheral iris, but where I know there's an area on the IOL. I remove quickly, the chamber stays formed, nothing moves. This is a successful case. And so that's my technique. In summary, we found that Dexycu does adhere to the intraocular lens optic, and that if you place the Dexycu in the peripheral optic or in the capsular bag adjacent to the optic, you can maintain superb positioning. You will have a very easy time at the end of the cataract surgery. Your patients will do well, as this location is a great location for Dexycu to provide its anti-inflammatory properties. Thank you very much for watching, and thank you for being with us here on Interventional Mindset.